Hi, I would like to speak to you today about one of the things that causes us pain, and sometimes we don't even know what is going on because some people term it as a mysterious illness because they don't know the solution to it. It's called fibromyalgia. It's chronic fatigue pain disorder. It's not an autoimmune disease. It is actually a chronic central pain disorder. It is a hypervigilant disorder driven by central sensitivity. To put it mild, to put it in a way that everyone would understand, it's simply a brain disorder. It is perceived as pain all over the body, anxiety to depression. You would also have symptoms like unrefreshed sleep to functional bowel disorder like IBS. So you could sleep for a long time and wake up tired. You feel fatigued, achiness. It is a complicated disorder that very few people fully understand. There are no easy way to test or to diagnose it. Most diagnoses of fibromyalgia are actually inaccurate. The person could have something else and be diagnosed with fibromyalgia. Women in their middle age in particular get these symptoms and are diagnosed with fibromyalgia, given medication, and they don't feel better. And this is because they don't get the right intervention. The antecedents to fibromyalgia could be genetic susceptibility or propensity, like offsprings of mothers who had fibromyalgia. So our genetics could determine if we are predisposed to having fibromyalgia. Trauma in our early life and upbringing, events like divorce, substance abuse, emotional or physical abuse, family unit circumstance. When we're stressed by all of these things, it could lead to fibromyalgia. When the nervous system is young and it's learning to deal with the world in that environment, it gets locked in this hypervigilant sympathetic dominance loop where it is constantly in overdrive, waiting for the next harmful event to occur. Over time, when this keeps happening, it has consequences that manifest into symptoms. It can be called catastrophic behavior when you think everything is an immediate threat, is an imminent threat. Even a light touch can be sensed by somebody who has fibromyalgia as pain, and they are unable to shut their brain off, which can lead to anxiety and unrefined sleep, even when they have slept, like I said, enough. It doesn't go down into a deep restful state. So when they sleep, they don't get this deep sleep. You could sleep for up to 14 hours and wake up like you never did. Fibromyalgia is related to perception and processing of stimuli. In this case, it's the brain. So the way we process things affects the brain. It's not a muscle problem. The problem is in the brain. It's brain inflammation. This could also have other issues. There could be other issues that cause the muscle problem and not just fibromyalgia. Some of the things that you can start doing to help yourself is to find things that keep you calm, things that bring you back to the rest and digest state and not in the flight or fright state. And some of these things, if it's not done, if you don't find strategies to make your body sense that there's no threat to it, no healing can take place. If you're constantly in a flight or fright state, digestion and rest cannot happen. And this is a state your body wants to be in for healing to take place. Things like, you can incorporate things like meditation, prayer, yoga, breathing exercise, staying away from your devices at least an hour before bedtime can help reduce anxiety. There are some supplements that can also help you. Things like magnesium, GABA, ashwagandha, serotonin. Some people also use CBD if you check with your doctor and it works well with you. The major thing you need to work on is sleep. Sleep is crucial to helping someone who's going through fibromyalgia. You need to get your body clock working well. Ensure you get to bed at least before 10 o'clock and get out of bed at a reasonable time after having at least 7 hours of sleep. Now, if you're constantly waking up at night to use the toilet or you're not able to go back to sleep, I need you to know that you have a blood sugar problem. Your body is stressed, okay? And until you change the way you eat and the way you manage your lifestyle, it's not going to work, okay? If you're interested in getting my 3 tips to help you start your healing journey, which is free, please subscribe to my YouTube channel, send me a screenshot and I'll send them to you. You really need to get your blood sugar in check. You need to make sure that your blood sugar is not high, because what happens, let me tell you what happens and why people wake up constantly at night. When you don't eat the right kind of food and you're also stressed by work, your relationships, financial issues, or anything at all, and on top of that, you don't make the right choices with food. When you sleep, because that food is food that spikes your blood sugar, whilst you're asleep, your blood sugar drops and your body needs to needs to keep you alive, and therefore it has to flood your body with energy to keep you alive. When it does that, it wakes you up and you can't go back to sleep because you have a lot of energy circulating in your body, and so you can't go back to rest. When your blood sugar goes down, when your blood sugar is balanced, your body is able to relax, sleep, and rest, and start to digest and start to take away things that should not be there. When your blood sugar is high, which is what happens when your body brings sugar out of your, brings energy out of your cell, you become very hyper, like somebody who drank energy drink, and so you can't sleep. So you need to eat food that keeps your blood sugar balanced, and you also need to learn to manage certain situations, especially the ones you cannot resolve. If you need help with nutrition, please send me a private message and I would send you my 3 free guides so you can start your journey. Another thing that you can add to help you with fibromyalgia is to eat whole food, anti-inflammatory food. Okay, it will support it. It will help to introduce protein, phytonutrients. Try to remove dairy, gluten, and processed sugar first. Okay, and this should help you start your journey to healing. Now, fibromyalgia is one that I am passionate about talking about because I experienced it a few years ago to the point, if you've listened to my story, it's on YouTube as well. If you listen to my story, you would understand why I'm so passionate about what I do with you all every Saturday morning. I was that person who could not stand on my feet from 6 o'clock because I was in pain in my body. I used to feel like I couldn't function. I never booked any appointment or made any arrangement for any social thing from 6 o'clock because I couldn't. My energy level just could not carry on. Okay. And I also experienced some of these nervous system issues as well. Like, I'll be talking and it will seem like my face is twitching or I'm slurring. These are all symptoms that something is wrong with your brain. And you need to start by regulating your blood sugar. I've just explained to you what happens at night when you're sleeping and why you can't sleep. Next week, I'll be talking about migraine. If you know anybody who suffers from migraine or always complains about headache, please get them to me. Get them to listen or to join us next week, Saturday, because I'll be talking about it. We should not live in pain. We should live in joy and optimal health. Yes, we're going to age. Yes, we're going to die. But whilst we're still alive, we need to live in optimal health and happiness. These are my yardstick for health. My yardstick for health is not how fat or how slim somebody is. You could be slim and have fatty liver disease. If a colleague of mine had a stroke 2 weeks ago, she's not fat. Okay? She is not fat. Please, health is your wealth and it's your physical pension. I really wish you well on your healing journey, and I'll speak to you again next Saturday. Take care. Bye.